moms, today I'm sitting with Dr. Namrata Jadwani, who's a dentist, and we're going to answer all your dental care questions today.
Hi guys, excited to answer all your questions which you asked last week.
Yeah, and we've got lots of great answers for you, and hopefully it'll
be very helpful for everyone.
Yeah.
Yes.
Okay, so let's start. When should the child's first dental visit be?
So this is something that's very important and I want all moms to understand. The child's first dental visit is ideally when the first tooth comes out.
Okay.
You know, everyone thinks it should be at a year or maybe 2 years, but it has to be when the first tooth comes out for multiple reasons. One, that we need to see the teeth coming out, the timelines of all the teeth. Two, we need to start getting the child acclimatized to a dental space. Because everyone's so petrified of a dentist, everyone's so scared.
Adults are also scared.
Everyone's scared, right? So what if you initiate it early? One, the appointments are very small. You're actually just usually playing with them and quickly, you know, checking them and incentivizing. Then we can also teach them the correct oral hygiene routine right from that point, because even when there is one tooth, it needs to be cleaned. It might just be with a simple sterile muslin cloth, or something as small as a phthalate-free, BPA-free vegetable bristle brush, which a lot of people don't know about, like finger brushing as well. But you can add a muslin cloth as well, because sometimes it's not always easy to clear out because the gums are there as well. So for your oral hygiene routine, to initiate them to dental care, to not make them scared, they know they come, they play, you know, and they get so comfortable that they know that this is a familiar space and you come out without pain. Okay. That makes them come very frequently. So when the first tooth comes, about 6-7 months is what I believe when it is when you should come in.
Okay. How frequently should you be visiting a dentist for your child?
So this is alike for adults and children. You need to visit a dentist every 6 months.
It's so scary.
I know, but irrespective of pain, and in fact I always feel if you go every 6 months, you'll never come with pain. Because you catch everything earlier, you get your dental cleaning done for adults. As for kids, obviously we check the growth of the eruption of the teeth. We check the growth rate. We check if there's any staining, any early cavity. There's a lot of anti-cavity treatments which we can give post 3 years, which is fluoride, which we'll talk about later. And there's also, we can actually predict whether the child will need braces or no.
From that early
on.
Wow.
From about 3 years old, we can always tell with the amount of spacing or lack of spacing if a child is going to need. We can also check for habits like thumb sucking, tongue thrusting, you know, which we can contain, and it may go unnoticed. You may just feel the teeth are proclined.
Yeah.
You know, so there's a lot of things that a dentist can tell you, and you can take care of in multiple ways.
So the earlier you start, it's always better for your child and for you as
exactly
well.
And like I said, they get used to you, so they get friendly with you, so they're never scared to come to you.
They look forward to it.
They look forward to it, yeah.
Okay, so what's the best toothpaste for kids actually?
So I'll tell you what, this is a question I'm asked very frequently as to what's the best toothbrush, what's the best toothpaste. I do feel like there are age-related toothpastes and toothbrushes available, which I'm going to show you right now. So this is something called as a pure baby toothbrush. This is for 6 months. Everyone feels like, you know, you don't have to brush a baby's teeth, or like what will a baby do at 5 to 6 months. Honestly, they just hold it. They know they have to put it in their mouth. They don't really brush with it. It simulates brushing. So it incentivizes them to understand that this is a part of their daily routine. And along with this, I don't have one right now, but there's something called as a training toothpaste, which again no one knows about. So it's like more like a vegetable paste. So these are all organic. I don't know about what the availability here is. These I've sourced from the US.
Okay.
Like there's something like a Tom's training toothpaste,
so
which you can use.
The Pigeon and those other brands.
Correct.
Swallowable toothpaste.
That's fine. So Pigeon, Chico and Colgate, anything is fine because they always specify the age.
Yeah.
So I always believe that more than the type of toothpaste you use, it's how you use it, how many times you use it, and how clean the child's mouth is. You could be using any of these, you know, but you need to create a routine where after every meal you are using a muslin cloth, because they can't rinse, right? Or they're drinking water and then you're checking for anything that's remnant. You know, then you have something like for 2 to 5. So this is 6 months. Then you have 2 to 5, which again has like, you know, you have these different shapes like cars and pandas and Barbie dolls and
that get them
something
excited.
which, and a little bit of a flavor sometimes like a strawberry bubblegum, you know, any of which can help. It's important to make them start doing this twice a day from as early as 1 to 2 years.
Post dinner.
No, so first in the morning and then post dinner. What they can do post meals is rinse and use a muslin to see if anything. Start getting them in the habit of drinking water or rinsing as they get older. And this is safe for 5+. This is again Barbie
Nice
toothpaste.
Barbie, fun. Yeah.
Now for anything 6 and above, I actually recommend switching to an electric toothbrush because one, the force is more controlled, the cleaning is better, and it's something that they really enjoy. Like there's Barbie, there's Batman, these are available everywhere. These are commonly available. You have multiple, shapes, and they go with a matching toothpaste of that age.
And so they enjoy it's fun for them.
It's fun for them, right? So I also recommend like changing it up,
Yeah.
Anyway, your toothbrush has to be changed every 3 months. So I recommend that when you're changing it, give them a new character.
And I have one question. Till what age do you move? When do you move to the bigger, older?
So this is the thing. Actually, the size of the head doesn't matter. Okay. You're supposed to use only pea-sized toothpaste, which again is a myth which adults and for children alike. So something like this is you can even use half the amount of this for toothpaste because it's got enough cleansing action. It's how they brush and it's how many times they brush that matters more than the
bristles should be soft bristles.
So for them it needs to be soft. It can be extra soft or an ultra soft for a child. But as they grow up, you can go to a softer bristle. For adults, I recommend anything between medium, soft to medium. It's not necessary.
Not hard. Right?
No, not hard.
Okay, great. Should we be using fluoride or non-fluoride toothpaste?
So you can start off with a non-fluoride toothpaste up to about 3 years. After 3, the American Pediatric Association recommends that you can initiate a very little amount of fluoride, and there's a recommended doses which you can keep increasing with age. After 5 or 6, I definitely recommend fluoride because you can always use your adult toothpaste after a certain age.
Yeah.
After 7 to 8, you can move them to exactly, and they need that fluoride because fluoride is a controversial topic, but it is anti-cavity. We do a lot of fluoride treatment. It protects. So out here we do fluoride treatments for kids 3 and above, which is just a 4-minute quick gel treatment where we apply the fluoride and they just have to stay still for like 4 minutes and that's it. They're good for the next 6 to 8 months basically.
Protects their teeth.
Yeah, and especially if they're completely cavity free, it sort of makes sure that they stay that way for the next few months.
And they say the water also has fluoride in it.
It does, but the thing is drinking water has a certain amount of fluoride, which is why they say that up to 3 maybe you don't need it because they're drinking that and that's enough for the dosage. But after that, we do recommend a little more fluoride application for cleaning and for anti-cavity.
Okay, that's great to know. What about brown stains and dark stains on teeth?
Yes, so I have a lot of kids coming to me with a lot of staining. Now, one of the most common reasons is iron supplementation. It causes these brownish, grayish, blackish, could be any color. Yeah. If you see those stains and if you say try removing them with a cotton or like sort of not scratching them, but you can see that they are removable. That's when you know that this is medication related. And which is why your 6 monthly checkups with the dentist are amazing because one, you can have them removed with the dentist slightly. You know that they are not cavities because sometimes brown staining could be the start of a cavity also. But that your dentist will be able to tell you. Sometimes mothers are also on medication during pregnancy like tetracycline and certain medicines which again affect the general color of your teeth. So we can predict and tell you what can be done or like what can be done at maybe at a later stage, not at a milk tooth stage. If there is a genetic discoloration of teeth.
So in the milk teeth when there are brown stains or yellow, what do you do?
So you basically have to just brush, they go away. If they are iron related stains, they go away. Your dentist can do a little bit of cleaning, scraping just to determine that these are the removable stains. But apart from that, I don't recommend any treatment as such. Again, if you keep it clean, use your cloth, your surface stains go anyway. That's about it. I think this should be good.
Thank you so much, Doctor. I'm going to put up Dr. Namrata's handle on this post, and if you guys have any questions, you can either DM me or DM her. And yeah, I hope this answered all your questions.
I hope it was useful, and I hope everyone starts a good regimen and brushing for their kids and themselves.
Visiting the dentist regularly.
Yes, we're not that scary.
Thank you, Namrata.
Thank you so much. See you guys.